Did you know that before a caesarean birth, the vagina is cleansed internally with a swab on the stick to reduce the chance of infection in most units in the UK now? I've talked before in many videos all about how a vaginal swab on a stick is used at the end of a caesarean birth to remove clots and also to help with cleansing to reduce the chance of infection. But many units and many places here in the UK and across the world now as well are now inserting a swab on a stick internally before the caesarean birth has started to reduce the chance significantly of infection. And yes, as standard, any person who is consenting to a caesarean birth should be fully informed about the pre-vaginal swabbing and also the post-vaginal swabbing as well as part of the procedure, as part of the process. So let's take a look at all of the research studies and the rate of caesarean births are increasing in the UK. Almost 50% of all babies are now born by caesarean birth, and around 27% of all caesarean births, women and people will develop a wound infection after birth. So around 3 in 10 births now has a wound infection in those first 6 weeks. So in one of these randomised control trials where they compared a group of women who had the vaginal swabbing on a stick to cleanse the vagina beforehand, only 4.5% of those women went on to develop an infection in the postnatal period. Women who did not have vaginal cleansing prior to the caesarean birth had an 8.8% rate of having an infection in the postnatal period. Now, when they looked at the detail even further, they found that women who had already had their waters broken, these were women who were already starting labour, who then needed a caesarean birth at some point within their labour, their birth, they found that there was an even more significant reduction in reducing the chance of having a wound infection when they did the pre-vaginal swabbing just prior to the caesarean birth. And what they found is that 4.3% of women whose waters had broken were likely to have a post-caesarean infection if they had received vaginal cleansing. However, 20.1% of women who did not have vaginal cleansing prior to the caesarean birth developed an infection, which is a significant reduction in that. And we've got to remember that wound infections have a big impact on women and people in the postnatal period. They're more likely to be readmitted, separated from their baby, have impacts on breast milk supply if they're breastfeeding, need further surgeries or wound debridement, for example, need oral or IV antibiotics, and have a much longer and harder recovery as well. And that's why the Cochrane database, the NIHR, all now recommend doing a vaginal cleanse before a caesarean birth. This should, however, be discussed with women and people as part of the consenting process so that they're aware of it. It's not done before the spinal is effective, so it's waiting for that pain relief of that spinal, that epidural, or the general anaesthetic to be effective before doing the pre-vaginal cleansing, and it should be something that is also discussed with you at the time of them doing it too, so that you are fully aware of what is happening with your body.